Fear, one of the most powerful emotions, has a very strong effect on your mind and body. It will take effect when you're faced with dangerous events, like traveling on an airplane. For some, it's business as usual, but for others, it can be an experience fueled by nightmares. Imagine, you purchased your ticket to fly to Hawaii on vacation. You hear your alarm go off. You get up, get dressed, and you're off to the airport. You wait patiently as you board your flight. You're enjoying your flight thus far. But suddenly,
this is your captain speaking. We might have to land. Please assume the correct position for emergency landings. You will be guided by the air hostess. Please, stay in your seats and remain calm.
Blood clot, this no look good.
Hardwired into our DNA, aerophobia is a fear that can occur as a result of a single trauma as well as many external factors coming together. Humans were not born afraid to fly. This fear has later become a part of human personality. Nevertheless, the condition can be treated with the help of a psychiatrist. Over time, and with the right combination of cognitive and behavioral therapy, a fear of flying can be cured, according to psychologists who offer treatments at such aerophobia clinics like Boston University's Center for Anxiety and Related Disorders.
Yes, science!
The odds of you dying as an airplane passenger are low, when compared to drowning or meeting your end in a car accident. Be honest. The first step in treating aerophobia is to acknowledge that the fear is present. Because flying is something that many people do, people can often feel too embarrassed to speak up about their aerophobia. Remember that phobias affect many people, so you are not alone. You might be surprised how many of your friends and colleagues may struggle with the same fears. You might find people who have overcome this phobia and can be an encouragement to you. Take a page from out of their book. Be a conqueror. Step onto the airplane with knowledge. Anxiety thrives on ignorance, and feeds off what-if, catastrophic thoughts. But once you become knowledgeable, your what-if thoughts are limited by the facts. Become familiar with the facts. They will not eliminate your anxiety, but they will help you manage it. Airplanes are capable of flying themselves, given that they have an autopilot that is coupled to a navigation system. Most autopilots are. Usually, the autopilot is engaged soon after takeoff, and remains engaged until just before landing. I would estimate that over 90% of most flights are flown with the autopilot engaged. Set travel goals. It's easy to procrastinate on working on fears like aerophobia. But if your life is inconvenienced, or diminished by not being able to fly, then it's important to set goals for yourself. Think of a place or person you want to visit and set a date on the calendar for when you'd like to visit them. Physicians can prescribe medications as needed for flight anxiety. The most common class includes benzodiazepines like Xanax and Ativan, which are relatively fast-acting to relieve anxiety and stay in the body for several hours, which is the duration for most cross-country flights. If you think you or someone you care about may be suffering from aerophobia, anxiety, or any other mental health condition, Wings of Freedom 876 strongly recommends that you seek help from a mental health professional in order to receive a proper diagnosis and support. Thank you for watching.